Hello and welcome back to the channel. My name's Grant Frost and I'm an Australian musculoskeletal physiotherapist who's really passionate about trying to better understand the root underlying causes of common aches, pains, injuries and dysfunctions. And in today's video, I want to talk to you about a potentially hidden cause of shoulder blade pain. And not only that, I want to give you a series of exercises that you can try that will hopefully help you better understand if your pain is actually coming from somewhere else. So let's get into it. So this video, as always, is inspired by things that I find clinically with my patients. And over the last few weeks, I've had a number of people come in with pain on the inside of that shoulder blade that they just haven't been able to shake. But based on what I've found clinically with these patients, the hidden cause of that shoulder blade pain may actually be coming from your neck. And more specifically, the bottom half of your neck. And while it's always important to make sure that if you do have shoulder blade pain, that you do take a step back and consider broader things that could be referring to that area, we also want to make sure that your pain isn't coming from the joints or joint dysfunction underneath, whether that be your spinal joints or your rib joints as well. So what we're going to go through is in this video, I want you to take your tennis ball or lacrosse ball, and we're going to use that to see if your neck or your upper back is the underlying cause of your dysfunction. And the best way to obviously do that is we want to make sure that we take a baseline measurement of how that shoulder blade pain feels for you in the moment, whether that be doing a particular set of movements or an activity that you feel gives you your symptoms. And then what we're going to do first is we're going to treat your neck with the ball to begin with. Then we're going to come back to that same movement, reassess to see if anything has magically changed. And then depending on how that went, we're then going to move down to the area that you may find is symptomatic to see if that is the root underlying cause of that shoulder blade pain. And then once you take your ball, where we want to start is because we want to look from sort of the middle of your neck down to the base of your neck. We can take that ball, place it right on the bump in the middle of your spine, halfway down the neck, and then just let the ball roll off to the side a little bit. And then as we always do with this exercise, we can get you to lie down on top of the ball and just gently twist and rotate your body so you feel like the ball is pushing into something meaningful. Or you can do the same thing standing up against a wall. But if you can get down and get into this position, again, what we're always looking for here is we're looking for things, particularly joints and soft tissue, that feels stiff, tight, restricted, harder, and more dense than the other side does. And what's really important here is we're not just looking for things that feel tender and sore. Because part of the mystery around shoulder blade pain can be that if it is coming from your neck and your neck doesn't overtly hurt during the day, it may not necessarily feel meaningful to you. So in order to make sure that we're not missing a really crucial potential piece of this puzzle, we may not be expecting this to feel tender for you. All we want you to do, stay here, take a couple of deep breaths, try and relax onto the ball, give it a chance to push into any stiff, restricted tissue that you feel. Stay there for 30 seconds, 60 seconds, whatever you feel is warranted for you. And then from here, we want to segmentally and systematically move the ball down a little bit at a time, trying to capture the joints and the segmental soft tissue of your spine. Keep putting some pressure on those areas and then work your way down as low as you feel you need to until you feel you get to the top of your upper back. Once you feel you've had some meaningful change in that area, then immediately come back and reassess how your symptoms feel with the movements that you performed earlier. And then immediately let me know in the comments down below, did you feel any genuine change? If you did, amazing. You may have just found the hidden root underlying cause of that shoulder blade pain. If you do feel like everything is looser through your neck, but your symptoms feel exactly the same, then that's also fantastic information because that may mean that it obviously isn't neck related. And if you didn't feel that benefit by freeing up your neck, then obviously we want to work lower than that through the spinal joints and the rib joints of your upper back that all of your shoulder blade muscular sits upon and your shoulder blade functions on top of to see if that is the root cause of that shoulder blade pain. And how that again looks, it's the same concept. As we sort of come below the biggest bump at the base of your neck, we come onto your thoracic spine. Again, we're on the bumps down the middle. We just want you to move the ball deliberately straight off to the side, not all the way across to your shoulder blade. You can be in the middle of the two if you want to be on the ribs, but we want to be somewhat close to the bumps down the middle without being on them to try and hit those spinal joints. And then same concept again, we want you to lie down on them, and you can also do this up against a wall. Just shift your body weight across to that side just to get a sense of how it feels. Let the ball press in, compare it to the other side. Again, choose the side that you feel is the most stiff, tight, and restricted. And once you've spent some time, again, on those spinal joints, if you move out a little bit closer towards your shoulder blade on that side, you'll now be on the ribs and hopefully be affecting and impacting the rib joints. And depending on how you feel, you can obviously just stay here. Again, take a couple of deep breaths, try and calm everything down. If you feel like you're on a really tight spot and you're just not getting the pressure that you need through the area, then what you can do is you can bridge up a little bit to put more body weight through those joints if it needs a little bit more of that pressure. Once you've spent some time systematically working all the way down to pretty much the base of that shoulder blade level, then again, immediately come back to all of those same movements that you've already done to compare the results. And as I promote on this channel all the time, we need to base everything that we do on results. Genuine results obviously tell us what's important, but on the flip side, a lack of results can also help us better understand what we're not dealing with and help us narrow our focus down on what is more important for you that will generate those results. Because once you have an understanding of where that pain is coming from, what we're going to get to at the end of this video is we need to have a conversation about why those exact parts of your neck or your upper back or both have become dysfunctional enough to generate pain in that space. And if you'd like to see some strength exercises that you can do to help improve this as a whole, please consider signing up as a member and checking out the members only exclusive extended cut of this video. But following on from that, the next thing that we want to explore with you is what role, if any, are those specific local shoulder blade muscular tightnesses having on your symptoms. And a great way to mobilize those shoulder blade muscles is with a banded scapular stretch. So once you've explored what role your neck or upper back joints may be having on your shoulder blade pain, we do want to make sure that if any of your shoulder blade musculature has become tight or spasmed or developed those trigger points, that we do something to try and see if that can calm things down as well. And for me, clinically, a really nice way to stretch some of your shoulder blade muscles is by using a power band. And the way that we want you to do this is we want to hook your hand up underneath and then let your hand come over the top. From here, we want you to take a small step back so you get some tension on the band. And then we want you to turn your palm up just to stabilize your shoulder. The benefit of doing this is that when we block your hand gently without holding on, we're just blocking it and stopping it from turning again. By externally rotating your entire arm, it then allows us to direct more of the motion through the shoulder blade musculature at the back. And then from here, if you hinge forward from your hips a little bit, you should then be able to target some of the musculature that you feel attaches to your shoulder blade. Once you've found it, we can stay here for 60 seconds, 2 minutes, get that tissue to accommodate and relax. To speed it up, we can try and squeeze that muscle, tense all the muscles in your arm and your shoulder blade up for 5 seconds. Again, when you stop and relax, you might find that it'll give a little bit. And you might be able to go a little bit further into the stretch than you could before. And just keep moving around and hunting around to find where the best version of that shoulder blade muscle tightness is for you. And then again, once you've done that, just retest how things feel and function to see if you've made any meaningful change. So the final thing that I think is crucial to talk about when trying to better understand why one particular part of your body has become a problem is we need to talk about your day-to-day postures and shapes. As I mentioned earlier, if you have found that either your neck or your upper back or both is the hidden cause of that shoulder blade dysfunction, then for me clinically, and what I found with my patients when discussing this topic with them, is that they share a common theme that when they're not paying attention, they may inadvertently either slouch or create a hinge through those exact parts of their body. Whether they're using their phone, reading a book, using a computer, driving a car, or just sitting down and watching TV. One of the main things that you need to take away from this video is that in order to solve that shoulder blade pain, we need to pay attention to the positions and the postures you either put your neck or your shoulder blades into the most throughout the day. Because if you do consistently lose that good upper back posture and you do have a tendency to look down through your neck a lot, tension that we create from being in these positions often helps explain why specific parts of your body become stiff, tight, and eventually tender when they shouldn't. And if we can pair up some good mobility exercises with some of the strength exercises that we've been through in the extended cut of this video, in a way what we're trying to do is not only undo the effects of what we may have unknowingly created for ourselves, but by freeing up those stiffnesses and strengthening the tissue in those areas, we're trying to make being in a better posture more convenient and successful for you day to day. So I genuinely hope, as always, that was helpful. If it was, again, please let me know in the comments down below. Please consider leaving a like or subscribing to the video. If you want more exclusive content from me and more consistent specific access to me, please consider joining up as a member of this channel. But as always, I genuinely hope that was helpful and hope to see you next time.